Welcome to Home Aide Training Center Digital Classroom. This is a production of Home Aide Training Center. This is a DHS approved HCA school, and we are based in Federal Way, Washington, United States of America. And we are just right behind Walmart or next to Federal Way Transit Center. I'm your instructor, Dr. Stephen Jenga, and today we're gonna take you through our second lesson in mental health, level 1, capabilities of caregiving. And if you remember what we talked about last time, we talked about mental health conditions, and we talked about examples of them as attention deficit hyperactivity disorder, ADHD. We also talked about anxiety disorder. We talked about autism spectrum disorder. We talked about bipolar disorder, borderline personality disorder, depression, dissociative disorders, eating disorders, obsessive compulsive disorder, post-traumatic stress disorder, PTSD. We also talked about schizophrenia, schizoaffective disorder, and also we have got related conditions. And these related conditions, some of them we say they are anosognosia, duodiagnosis, psychosis, risk of suicide, self-harm, sleep disorders, substance abuse. These are some of all the mental health conditions that we looked into last time. And I want us to start today in our second lesson into discussing attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder, ADHD. This is a condition that usually affects mostly young people, although it affects people of all ages. So the symptoms of attention deficit hyperactivity disorder, ADHD, include being distracted. That means if you are doing something, then you can easily be diverted from what you are doing. And then we have this condition is what being extremely active. You are being extremely active and acting on impulse. That means you're not focused. Whatever you do, you may do this today, this time, this minute, within the next minute you're doing something different, or you're watching the television, the next moment you don't want, you're easily bored. So these are some of the things we're talking about. So most commonly diagnosed in young people, ADHD, as I had said before, although it affects all ages, and according to the National Alliance on Mental Health, an estimated 4% of adults have ADHD, attention deficit hyperactivity disorder. So what are the symptoms, if we may look into this? Some of the symptoms are: number one, you are easily distracted. So if you're watching the TV and you hear somebody listening radio station, you quickly can switch and start focusing to listening to the radio station. And then you can also easily be bored easily with a task. You can easily get bored into with a certain task that you could be doing. So another symptom is difficult focusing. You cannot easily continue with something continuously. So difficult in focusing attention or completing single task or activity. You have trouble completing task or project. So if you are playing chess, you leave the chess and then you go and start watching the television. You stop watching the television. In a moment you want to go to the mall. You have that problem completing tasks or projects. And then the other one is not listening or paying attention. So you could be told you stop doing something, but you just find yourself continue doing the same thing over and over again. So then you can also be daydreaming or withering with lack of motivation. You get bored quickly. Withering, that means your mind is not stable. So this moment you could say, I want rice and chicken, and in the middle of the cooking, then you say that you want chips or you want macaroni and fish. So you have that lack of motivation. So difficult. You also have a problem you have difficulty in processing information quickly. So when you talk about hyperactivity, this has to do with the fidgeting and screaming, trouble sitting still. That means in one moment you're in your room, the other moment you're in the dining room, the other moment you're in the kitchen, you're all over. So that's what we mean. And then you can also have a problem in non-stop talking. You can talk over 50,000 words within a very short time. So these are some of the things. You have non-stop talking, you have problem with the touching and praying with everything, radio, television, and difficult in doing quiet tasks or activities. So these are some of the things that we are talking as hyperactivity. So, and then we have impassivity. When you talk about impassivity, we are saying that you are impatient. So if you say that you wanted somebody to prepare tea for you before even the normal period for preparing tea is over, then you say you want lunch, so you have difficulty in waiting. So the other one is acting without regard. Doing something without minding about the consequences or the outcome is what you're saying, that is acting without regard for consequences or blurting things out. So you may also have difficult taking turns, waiting, or sharing. So these are some of the impassivity we're talking about, and also it's also common that you could be interrupting others. So that is attention deficit hyperactivity disorder and ADHD. And let's look now what are the causes. Some of the causes: one is genetics, may cause a high risk of developing ADHD, which runs in families and in traits in specific brain areas that contribute to the attention. So when you talk about it is genetic. When you talk about it is genetic, it means it's something that is a condition that probably a person can be born with. And also something else that can also cause attention deficit hyperactivity disorder, ADHD, is environmental factors such as cigarette smoking, alcohol use during pregnancy, or exposure to lead as a child may lead to increased unlikelihoodness of ADHD, according to the study. So these are some of the things that we need to know. When it comes to treatment of ADHD, treatment plans are most effective when tailored to an individual's needs. That means if treatment has to be administered, the needs have to be identified first. Number two, you can also have behavioral therapy. That means you can have a therapy of somebody who will guide and help you to be focused in your behavior. Elimination diet to determine if food allergies, sensitivity plays a role in sensitivity of symptoms. So as you can have a elimination of diets, you want to refrain from certain food, for types of food, to see whether they could be contributing to some of these factors. So then medication can also help as a form of treatment. Neurofeedback, EGH biofeedback. So You can get whether there is an improvement or not. You also, nutritional supplements can also help in treatment. So for more information on mental health or medication, you can visit National Institute of Mental Health, www.nih.gov. So, some few questions here. What is your attitude about this disorder? That is ADHD. What is your attitude, you as a caregiver? Number two, what are the facts about this disorder? What are the facts? What do you know about it? The other one is how can you be supportive of people with the disorder? How can you help them as a caregiver? So those are some of the questions that should be at the back of your mind so that you can be able to help these people. The second mental condition we're going to talk about is anxiety disorder. Occasional anxiety is normal. So it is normal to have occasional anxiety. It's normal part of life. And anxiety disorder, first of all, you need to ask yourself, what is anxiety? It's a feeling of worry. When you feel you're so worried and fear of a real or perceived threat. You can feel worried over something that you know this is real, it's gonna happen, and sometimes you can have a worry of unknown fear. So so these are some things talking about perceived fear that does not go away and can get worse over time. You have fear and this fear doesn't go away, it is with you. That is anxiety. So anxiety can interfere with the functions of normal daily life and affect relationship. So you find that you are compassed, you don't want to talk to people, just want to lock yourself in your room, or this can affect relationship. So anxiety disorders are the most common mental disorder. These are the anxiety disorders. They're the most common mental disorder in America. In 2015, an estimated 18% of adults in the US had anxiety disorder. Symptoms of anxiety disorders can become chronic and debilitating if not treated. So if you don't treat the disorder, this can become a great concern. What are the symptoms of anxiety? This feeling of worry, of known fear or perceived fear. What are the symptoms? Number one, you feelings of worry or dread. You dread something bad is going to happen to you. And also you may feel tense. You may feel tense and jumpy. You may feel restless, or irritability. You get angry faster. Those are some of the things we're talking about here. You're also anticipating that a worst is going to happen. So when you anticipate that something worse is going to happen to you, then there is a problem right there. So those are some of the emotional symptoms. Whatever we discuss it is not something that you can see. But when you talk about physical symptoms, then that is what we can call emotional symptoms. You cannot see these feelings because it's not something that you can see or you can touch, but then they are inside of you. What are the physical symptoms? Number one is pounding or raising heart. If you touch your heart, you feel it's bumping. So then you can also experience shortness of breath or difficult breathing. You can experience shortness of breath or difficult in breathing. Then you can also have upset stomach. You can have an upset stomach. You can have sweat. You can have fatigue or insomnia. These are by your lack of sleep. So you can also have even sometimes frequent urination or diarrhea. You can imagine how serious anxiety can be. So, and then we have types of anxieties, and one of the most common anxiety disorder include generalized anxiety disorder. And I will say that these are some of these. They are common type of anxiety. So then we have panic disorder. Maybe you have fear, and I've said fear of known or sometimes fear of unknown. And then we have phobias. You have social anxiety disorder, meaning that you don't want to, you have a problem associating with other people. We are continuing the mental health level 1 in home care aid training. So let's look into generalized anxiety disorder. So when we talk about generalized anxiety disorder, number 1, generalized anxiety disorder, GAD, is a disorder characterized by exaggerated worry about several aspects of life, such as work. Probably you have fear of being fired. Maybe you have fear, maybe your boss is gonna fire you. Sometimes social relationship, you have a relationship that is not working well, that can cause anxiety, or you can also have general anxiety disorder because of worry of finances, what is going to happen. And okay, so individuals with GAD or generalized anxiety disorder often expect the worst even when there is no obvious reason of concern. So you're always expecting evil even when there is no cause of alarm. So this is an issue that can also affect you a lot. Okay, so it's difficult to control worry or more worry on more days than not for at least 6 months, and then has 3 or more symptoms. So if it goes more than 6 months, then it's getting serious. So what are the symptoms of generalized anxiety disorder? Number 1 is difficult concentrating. You cannot be able to concentrate. You cannot be able to complete a task. So the other one is difficult controlling the worry. You cannot help to worry, no matter how many times people may talk to you, or you cannot be able to prevent it. You can also have fatigue and exhaustion. Irritability is whereby you get angry quickly. You find yourself getting angry quickly. You can have muscle tension. You can have nausea. You can have restlessness, or you are nervous. You can also have sleep problems. So these are some of the things we are saying that they are called generalized anxiety disorder. So can we look into panic disorder? When you talk about panic disorder, is debilitating anxiety and fear arising frequently and without known reason. You just have panic. You panic. You are afraid even without no reason. So this is panic disorder. More frequent triggered by fear of producing events or thoughts. So if your thoughts, if they are producing fear, they are processing fear, then you have panic disorder. So often mistaken for heart attack, panic attack causes powerful physical symptoms. Panic attacks can last for few seconds to several minutes, okay? Because people suffering from panic attacks experience terrible distress, and during such attacks they often are worried, you are anxious about suffering future panic attacks even with no perceived reasons. So what are some of the symptoms of panic disorder? What are some of the symptoms? So we have agitation. You can you easily angered, anxiousness. So this worry. Sometimes you can have chest pain. You can have dizziness, fear or avoidance of places where panic attacks have occurred in the past. So if you are assaulted over a certain path, then you're passing through the same route, then you have the panic disorder, because your mind is telling you that whatever happened to you in the past gonna repeat itself again. So fear of dying, you're afraid of dying. So feelings of being out of control during a panic attack. So you feel like you are gonna overreact when something happens. So heart palpitations, hyperventilations, intense worries, when the next attack will happen, rapid heartbeat, shortness of breath, stomach upset, you may have problems with your stomach, and sudden and repeated attacks of intense fear. You could have thinking. So these are some of the symptoms of panic disorder. Is there anybody with a question? That marks, we're going to take a short break, and then we'll continue when we come back. Home Aide Training Center, we train skills for life. Thank you. We take a short break, and then we shall continue from there.